Hello! This is Dr. Claudine Roura, the Fat Sucker, and welcome to my channel.
What is Endolift? Endolift is technically an internal laser system that delivers precise laser energy into the tissues to contract tissues and stimulate new collagen formation. So, that is your Endolift. It uses a diode laser, 1470 nanometers, and it's delivered via microfibers. We'll show you while we are doing the actual procedure. Okay, so we are going to do Endolift laser skin tightening treatment. Okay, so first, this is our patient. It is done actually under local anesthesia. So we're going to put local anesthesia on her neck and on her face, and after we do that, we deliver the laser energy for that one. Subjects for Endolift are generally those that seek improvement of skin laxity. Okay? If they're a little bit mildly sagging already, either by weight loss or by aging, then she would need or he would need the Endolift treatment. So this is skin tightening. Skin tightening is like shrink wrapping of the skin. So think about bacon. Okay? So remember, when bacon is raw, it is loose and floppy. When you cook it, it shrinks and tightens. Okay? Just like what you call the shrink wrapping. If you have shrink wrap, when you heat it with a blower, it shrinks. So basically, heat is the one that tightens the skin. So essentially, when you do skin tightening, there are a lot of modalities out there. Okay? Like you have your Thermage, you have your Ulthera, you have your HIFU, RF, all of these are radiofrequency. Everything is heat. So heat is the one that contracts tissue. Okay? But the main difference between this modality is that we go internally. Majority of the heating modalities just go on top of the skin to stimulate the dermis to contract and produce more collagen. In our case, we're going to go internally. So it is more effective with deliver precise energy directly into the tissues that we want. It's either we melt a little bit of fat, we go to the fatty tissues, or we do a little bit more of skin tightening, and then we hit the more of the dermis. Okay, so we will start. Local anesthesia, please. Usually, the standard areas when you say Endolift is like mid to lower face and the neck. So that is all included. We are finished with the local anesthesia. Now we do the treatment proper. Our focus now is just skin tightening. I will not do fat melting for her. So the Endolift is actually laser lipolysis. So you have, depending on your depth, you can either melt fat if you stay on the subcutaneous area, or more of tightening of the skin. Huh? So for her, it's more of a skin tightening procedure. So we go more superficial. So this is the finished area here. See, look at the see that? This is still very loose. This is a lot tighter now. See? Especially in this area here. Okay, so we're finished with her neck. We're going to do on her face. Hey, here you go. It's tight. So, how do you feel?
Tight.
Tight, no? Okay, yes. So, normally, post-op, intraoperatively, you usually wouldn't feel anything. The most uncomfortable part is the infusion of the anesthetic. Once you have adequate anesthesia, and then very comfortable treatment. Now she feels tight. Post-operatively, they will feel tight. They have a subjective feeling of tightness, and we have an objective feel of the tightness from their skin. Okay? So we're finished with the neck. We're gonna go now to her face. Okay, so we're finished with one side. This part of the cheek here is more lifted, and this is finished already. Okay, this is saggy, this other one is tight and have full. Okay, if you look at this side, look at that jawline over there. On the other side, it's not so defined. Okay, so we're gonna work on this one. Okay, here we go. So we're finished on both sides. Look at the tightness. And how does it feel?
Tight, Doc.
Okay. Yes, it feels very tight. They have the immediate sense of tightness. Post-operatively, so she's swollen anesthetic, and then she will swell a little bit in the first, usually on the third to the fourth day, it's more swollen, and then usually on the fifth day, it starts to go down. Okay, so best result 4 to 6 months. Okay, it just gets better with time. Okay, so if ever you need to do another one, if you want more, the earliest will be 6 months to a year. Okay, but in general, the effect would last around 2 to 3 years. Okay, and then if you want a little bit more, of course, as we go along, the aging process is not halted. It's just, it doesn't stop. It just prevents it to progress further. Okay, there you go. Okay, so there you go. This is your Endolift for the face and neck. Again, finished.
To watch more videos, like and subscribe to the Fat Soccer channel. And again, this is the Fat Soccer, Dr. Claudine Roura saying, see you in our next episode. Bye-bye!